people who are taking hormones are often using conventional hormones. Conventional hormones are not really hormones. They're um, maybe a hormone for a horse, like Premarin, or a hormone that's made in a lab, like Progest. There's a thing called Progest. It's women use it as like a progesterone type thing that women get in a store or from their doctor. But it's not progesterone. It's made in a lab. It's a chemical structure that's similar to progesterone, but when you do a lab test for these progestins, which are not progesterone, the progestins, it turns out that you don't see them in any kind of lab. So there's no way to measure them, there's no way to account for them. They create all kinds of nasty side effects in the body, and actually they don't create any side effects, simply the effects of these quote-unquote hormones, which are not hormones anyway. They're some kind of lab experiment, or horse hormones, like from horse urine they take Premarin. So the effects of these types of things, or birth control for example, are all kinds of problems. So birth control is associated with B vitamin deficiencies. It's associated with all kinds of difficulties with being able to think clearly, foggy thinking. It's associated with increased uterine tract infections and vaginitis. Okay. Birth control is associated with infertility for sure, and birth defects even. So it's not so good. Birth control is associated with vascular problems. For example, it's associated with stroke. And for those women who both smoke and use birth control, they're at a very, very high rate for what's called a transient ischemic attack, which is going to be a brain injury or some other vascular related injury or problem. And these are very, very common. So trying to kind of go over everything all at once, there's a lot to understand about infertility. But one of the most important things to know is that we can help you with all these things. Now, women get in the most trouble when it comes to their health, because a lot of the things that our society promotes are really unhealthy, unfortunately. So, for example, there's a lot of chemicals in hair care, body care. Sun care tends to have chemicals in it that actually are associated with ovarian failure, believe it or not. It's very similar to pesticides. And then women also like to put things in their hair that tend to be toxic. They tend to wear nail polish that's toxic, hair color that's toxic. Oftentimes the water that they're drinking, not just women, everyone, tends to be not supportive of good health. And just the list goes on and on and on. So unhealthy woman, unhealthy pregnancy, unhealthy child, or not even an ability to have a healthy child. Of course, the man may also be a problem if his sperm is impotent, meaning not impotent, but I shouldn't really say that. If his sperm count is too low, meaning if there's not enough sperms for the amount of fluid released in the semen, then there may not be enough of the little sperms that penetrate the the egg that's released, and then a woman may not get pregnant that way. Sometimes a woman is incompatible with the sperm of their husband. Sometimes they're actually allergic to the sperm of their own husband. I mean, there's so many different things that can be related to infertility. It really needs to be addressed on a case-by-case basis. You can't just like do a quick video and have it all kind of come together with you. You need an expert who really understands these things. And as you can see from these videos, I am that expert. We've helped a number of people, oftentimes just with making some basic dietary changes and helping women with more water and more protein. You can't have a healthy child and create a healthy placenta without a good source of protein. So thanks for coming and watching, and we look forward to supporting you with your health.